Well, welcome to the physical therapy portion of the Back in Action presentation. Thank you for joining us today and look forward to sharing some tools to you. My name is Dustin Krampitz. I'm a physical therapist at Enloe Outpatient Therapy, and I've been here for about 15 years and involved with the back care program for probably about 10 of those years. It came about from finding that patients could benefit from more education, and also after finding out from personal experience from back surgery how many tools that we could share with folks prior to surgery to help their process and to facilitate healing. Any surgery can be an overwhelming experience, especially spinal surgery. So we will share with you today a bunch of those tools that will help make it less overwhelming. We'll also talk about how to safely move and how to slowly initiate safe exercise, and also just to use positions and biomechanics to help facilitate the healing process and decrease tension on the surgical sites. We'll also want to encourage you to be an active participant as you move forward through this process. And what that means is be open to change, be open to changing the way you move, implementing new strategies. It also means that after the surgery, that you participate in your therapy while you're in the hospital. We found out that it is the most important thing that you could do is to listen to the therapists and the nurses, to get out of bed as soon as possible when you are done with the surgery. And this helps prevent pneumonia, bed sores, contractures. It also helps start to get your lungs and circulation back up to speed. So just remember, when you wake up from surgery, you will be sore, you'll have some discomfort, but it is important for you to get up and get out of bed. Role of therapy, we'll be talking about how to safely transfer, getting in and out of bed, cars, chairs, talking about a little bit about walking, lifting. Just a quick mention about cars. It is helpful if you have a car that is a SUV, or have a neighbor or friend that can help pick you up from the hospital. If a car is very low or very high, it is more difficult to get home. We'll also talk about a lot of pain relieving positions, and also mention here quickly the use of modalities, which is fancy word for ice or heat or e-stim. If you have those tools at home, they are helpful to decrease your pain. There are no side effects to those, versus there are side effects to the medications, as we mentioned before, with constipation, cognitive changes, and things like that. So the sooner we can decrease the pain medications, the sooner that your body can get back into its normal function as well. And we'll talk about briefly some exercises to increase your overall strength and flexibility. Here's a quick overview of the spine. So we have our cervical spine here at the top, our thoracic spine in the middle, and our lumbar spine at the bottom. Historically, most injuries or degenerative changes occur around your L4, L5, S1 area down here, or also into your mid-cervical spine around C5, C6 area around here. And there's a lot of theories on why that is. It could be posture, could be mechanical stress points with repetitive motions. It could be from traumas, because of whiplash or falls, where there's fulcrums that happen at these certain parts of our spine that make it more vulnerable. We'll also talk about how this part of your spine isn't made to twist, whereas this part of your spine can rotate and twist. So you need to be very careful to avoid any twisting activity down in this area. It is also good to note that each one of these segments here moves about 2 to 5 degrees. So if we have a surgery or a fusion and we take up and we fuse 3 or 4 segments, now we've lost a considerable amount of motion through the spine. And if we continue to use bad biomechanics, now we're increasing more torque or more stress on the parts above those fusion or below those fusion sites. So we want to make sure that we learn how to use our hips and keep our spine neutral as we move forward. Here's a picture just showing a picture of the disc, the canal where your spinal cord runs, and there is a pretty close relationship between the two. And if there's compromise in that spinal canal, then that's where you could have a lot of the symptoms into your legs, weakness, numbness, tingling, things like that. So just showing that portion right there. This is showing the side view, showing where the nerves from the spinal cord exit the spine. They exit through these little holes called foramen. These foramen can get narrowed over time, or genetically they could just be smaller depending on your anatomy. And if there are osteophytes or degeneration here, that decreases the amount of space that those nerve roots can run through. So, and nerves don't like pressure. And sometimes we forget that nerves also have nerves. And so when we irritate nerves, we're also irritating the nerves of the nerve, which creates a big red flag to the brain. Here we'll briefly talk about muscles. A lot of times we look at the x-rays and the MRIs and we see the spine and the disc and things like that. But we have to remember that there's a lot of muscles that attach around the spine. We have about 8 layers of muscles just around our abdominal wall, act as a corset that wraps around your whole spine, that holds pressure. Then we also have all these muscles that attach to the joints of our spine. We have little tiny ones and we have big long ones. And a lot of the discomfort from a surgical procedure is that incisional pain. To get to the disc, to get to the facet joints, to get to the spine, you have to go through about anywhere between 1 to 3 inches of muscle tissue. So that's a lot of healing that has to occur after spine surgery. So when you are sore and have discomfort after surgery, a lot of that is that incisional pain of those muscles healing up, and the skin and the fascia where they glued everything back together and use sutures. All that stuff needs to heal up and then restore mobility to it after it's healed up. So a lot of that discomfort is that incisional pain. So your therapist can work through with that as you heal and as the tissue gets to where it can be mobilized. That's a very important part of rehab. We'll talk about a few procedures that are common in spinal surgery. The first one here is a microdiscectomy. It's where you've had the encroachment of the disc onto that spinal canal, and they remove part of the disc so there's less pressure into that spinal canal. This procedure, compared to others, is relatively less complex, and the healing is a little bit quicker. But you still have to make sure that you apply those body mechanics and principles so we prevent further injury to those discs and joints. Here's a laminectomy and a laminotomy. This is a surgery that I actually had in my thoracic spine to relieve pressure on my spinal cord, where I was having numbness and tingling in my legs. And the only thing that felt good was laying down. Sitting hurt, standing hurt. So they did this procedure on my spine, where they removed part of the vertebra on both sides to create space for that spinal canal. And again, this is a relatively important surgery to allow decreased pressure so the nerves in that spinal cord can now be irritated. The next procedure we have is a foraminotomy, where they actually will increase the foramen size to create more space for the nerve root to run because of narrowing. And the last one we have here is a spinal fusion. And I like to show these pictures just not to overwhelm you or to scare you, but to show you that it's important for you to know if you have a fusion, what they've done. And so you understand the importance of how to change how you move, how you sit, so you can protect these areas as you move forward with life. Here on the neck, they did an anterior and posterior approach, where they put some plates and screws in the front and then some rods and screws in the back. This is showing the lumbar spine, where you have rods and screws, where they've decompressed the spine, try to create more space, and again, showing multi-segments that they've used. So here are the tools. So we're going to talk about sleeping, getting out of bed, sitting, standing, sit to stand, and lifting. And what's important about this is you can start implementing these things today. As you go over these tools in your brain and also watch the supplemental videos that we provided for you, you want to review these techniques and start to practice them and start making them part of your normal life. Because if you change how you move, it will dictate how you feel and how you heal up. So, and no one's going to be perfect with biomechanics, but if you're currently doing it 10% of the time, if you could do it 80, 90% of the time, that's going to give you a way better chance of feeling better and managing your pain and discomfort and facilitating the healing process. The other tool we'll talk about is just the importance of exercise. If you weren't very active before, we want to encourage you to seek help from therapists or other resources out there to get into an active lifestyle, to learn how to either get into a walking program safely or into a gym program safely, so you can become active. If you're already active before, our job is to help return you to those hobbies and to those things that you loved to do previously. Initially, walking is going to be very, very important, low impact exercise that will get you going. So if we start our day out already with some discomfort, 4 out of 5 or 4 out of 10 pain, just from sleeping, and we've already started our day out bad, and then we start doing some sitting in the chair that's uncomfortable, or if we're doing some lifting or bending with like laundry or unloading the dishwasher, things like that, now our pain starts to increase. So if we can start our day off in a good space, we can kind of control the activity throughout the day and the levels of pain. So here we go. We'll talk about sleeping first. The importance of good biomechanics. So if we look at this chart here, this shows a research study that they did where someone volunteered to have a pressure needle into their spine, into their low back, to measure pressure in different positions. And this diagram here shows a lot. Teaches us the importance of why we need to change how we move and be aware of how we move. As you can see in this first part here, if you're laying on your back, we have the least amount of pressure on our spine. And so as we talk about sleeping, we want to come up with ways how to further decrease the amount of pressure in that spine. Here's laying on your side. Again, we'll talk about how to decompress the low back with pillows and supports, but as you lay on your side, because of the angles of your spine, you will have increased pressure into your low back area. Then we talk about standing, and you'll see the pressure increases, which makes sense due to gravity. Here we look at standing and bending over, and again, we'll notice we know this isn't optimal for our spine because this creates a lot of pressure on our low back and a huge demand on the low back muscles and joints. So, but look at here. So if we look at just sitting in a chair, almost has as much pressure in your spine as you bending over like this. So we know that sitting has become, a lot of people call it the new smoking. So we need to get up, we need to move, we need to decompress our spine. The problem is a lot of our activities and occupations involve sitting. So making those changes. And then here we get the most amount of pressure in your spine is if you are sitting and then you bend forward, or to me, this isn't much different if you're sitting in a couch or in a chair where you're kind of sitting like a banana, or you're slouching where you're also putting that huge amount of pressure on your low back. So when we've had neck and back surgery, we need to pay attention to these positions so we can decrease the pain, but also facilitate the healing process. Tools for sleeping. You want to support what's not being supported, which means pillows underneath your legs if you're on your back, pillows underneath your arms if you're on your back, making sure that the pillows are all the way up to the base of your neck. And we have some good videos that will show these strategies for you. And just remember that sleep is when your body heals itself. So if you're being interrupted in your sleep with pain or discomfort, then you're never getting into that deep REM sleep where your brain can heal up as well. So you want to make sure that we're waking up refreshed and balanced. So here's some examples of poor sleeping postures. You can kind of see the fulcrum points on the spine. Again, we'll show this in the other supplemental videos. the importance of pillows and other supports. The gist of it is you want to support your legs and your arms as much as possible. Again, refer to the supplemental videos to help you out with that. Log roll. This is one of the other #1 complaints that we get with back pain, but this is also extremely important after surgery. So if you can start practicing today, it'll become like second nature for you after your procedure. And we call it a log roll because if you think of a log, you can't bend a log and you can't twist a log. All you can do is roll the log and prop it up. So you want to think of your body as a log. As you lay on your back, you bend your knees up, you roll to your side towards the edge. And as you let your legs come off the edge of the bed, you're propping yourself up with your arms. And so there's a fulcrum that's happening to allow decreased torque on your spine, but also facilitate your core muscles to fire. And we'll show a good video of that as well. Biomechanics while sitting. So we want to make sure that we have good back support. A lot of chairs are made for the average height person. So if you're extremely tall or extremely short, a lot of chairs just don't fit you. And so making sure that you're having the right supports, either sitting all the way back in the chair or sitting on the edge of a chair, so your feet have contact on the floor. Just because a chair has a back doesn't mean you have to use it. Oftentimes we'll actually be more comfortable sitting on the edge of a chair where you have more weight into your legs and feet with your wider base of support versus sitting in a chair where you kind of slouch or slide into the chair, and now you're kind of sitting like a banana. So you can also use pillows and towels or even patio cushions to help raise you up in the chair. I'm also a big fan of wedge cushions or the tailbone cushions, where it brings you up out of the crack of the chair, so you have better support on your pelvis and sacrum, not just your lumbar area. Very, very helpful in cars, very helpful in certain lounge chairs or recliners, that kind of thing. And we'll show some good videos of that as well. Good seated posture. So this just shows a quick diagram just to kind of give you a synopsis of overactive posture, where we're really sitting up really tall and straight, but we're using a lot of muscles and energy to do that. So eventually we get tired and then we end up like this, or we just sit like this because of the angle of the chair, because the chair is too deep, and then we end up sitting like a banana. And now we have a lot of stress points on our neck and back, which if you've had a back or spinal surgery, you want to avoid increasing pressure on those areas. So we want to think about lining up our whole spine so there's a disbursement of pressure all the way down to your base of support. Here's an example of poor sitting on the right. You can see the pressure in the neck and in that low back. Here's how we changed it. We add the pillow to help add a more vertical position to the chair. And then we also had the person scoot all the way back, so the pressure is going all the way down into the pelvis and base of support, not stopping in your spine and in the neck area. Here's an example of sitting on the edge of a chair. Again, just because a chair has a back doesn't mean you have to use it. If you sit on the edge and you can drop a leg down, that allows that weight to go forwards, allows your body to have a little bit more hinge at the hips versus having all that pressure in the back of your spine. And again, if after a procedure, we want to take the pressure off the back and distribute it more into the legs. Sitting, this is kind of a complicated thing because we have a lot of reasons why we have standing postures, but if you can practice standing in a wider base of support and allowing your pelvis to be in a more neutral position, so you're not tilting the pelvis forward or tilting it back. Your pelvis is kind of the keystone of where your lower body and your upper body meet. And so if you can kind of get that pelvis in the right position, a lot of times that helps relieve a lot of the pressure in the spine. So kind of showing where we have this pelvis tilted forward, this pelvis tilted backwards, and this pelvis tilted backwards. And a lot of times that's a keystone to distributing the amount of forces in your spine. So a lot of times you need some help with a therapist to work on this, but you can kind of practice on your own. A lot of times using a wall to find that neutral posture is helpful, and the therapist can go over that with you as well. But this is a huge component if one of your big aggravating factors is standing. So sit to stand. How many times a day do we get out of a chair or a seating surface? The answer is a lot. So if we could change how we do that by using a hip hinge, it is hugely important. So we do this by keeping a nice wide base of support, scooting to the edge of a chair. And if our feet are apart and we're at the edge, then it allows us to actually bend over, keep our nose way over our toes. That allows your legs to push up, allows your legs and your hips to do the work versus you lifting yourself up out of a chair with your back or even sometimes with your arms. And if you've had pain for a long time, a lot of times you get in the habit of using your arms to help out. So we are not strengthening our legs while we get out of a chair. So again, this is something you can start practicing today and get used to, so we can decrease that torque and tension on the spine. Here's our BLT. This is our physical therapy BLT. So this means no bending, no lifting, no twisting. So twisting, that's like I mentioned before, the low back isn't made to twist. So laundry, get stuff out of the laundry or get stuff out of the dishwasher, or sometimes activities in the bathroom, you end up twisting versus stepping or pivoting. And I like to think of it as if you had headlights on the front of your hips, you need to shine those headlights onto whatever you're going to pick up or grab or move. And that helps avoid you from twisting. Bending and lifting, you want to avoid those things as you heal up, usually about 12 weeks or so after your surgery. But as you get moving, you want to learn how to bend and lift safely. And we want to bend through the hips, not through our spine. And we want to lift with keeping things close to us, using our legs, not with our spine. So lifting and using that hip hinging, here's where we kind of talk about having a wide base of support, making sure that you keep things close to you. I kind of use the example of a T-Rex when we talk about that, whereas if you can picture a T-Rex having very short arms, you have to squat and bend through your hips to grab things or to move things versus bending through your spine. And I can't tell you how many times we've had people come in and say, all I did was bend over and pick up a pencil or a magazine, and my back spasmed or my back went out. And just because something weighs a couple ounces or a couple pounds versus a sack of potatoes or a package of dog food, it doesn't matter how much something weighs. It matters how you move to lift that object up. Very important to think about moving even with light objects. Holding things close, like we mentioned, don't twist. Moving obstacles out of the way. So this is where I talk about working smarter, not harder. You want to think about how you're going to move stuff before you move it. Try not to get into a rush. Sometimes we get in a hurry, or we need to go, and we need to take a step back and go, hey, what's the best way to do this task? And is it the need for me to get a friend or a spouse or a neighbor or my grandson, or do I need help? Sometimes we need to not be afraid to ask for those help when we talk about lifting and moving things. Here's a great picture of the hip hinge, and you can see the 3 points of contact on the head, spine, and the buttock area. And so the spine is not bending. All the motion is occurring through the hip joint, knee joint, and ankle joint. So we want to make sure that we utilize all these components and decrease the amount of torque and stress on the spine. And this brings up a good point. If you have weak hips, or if you've had an old knee injury or ankle injury, sometimes we need to do therapy on those areas to improve the ability to use good spinal mechanics. So make sure you communicate that with your therapist, and we'll work through those things to allow you to use good biomechanics. Here's an example of a poor hip hinge where you can see the bending through the spine as you're standing up or sitting down. And again, if you've had a procedure, this is going to increase pain because you're putting tension on the incision, the scar, and also on those components. Here's a good picture showing some anatomy of our hip joints, showing the size of our hips versus the joints in our back. So as we look at the spine, the components in our spine are about roughly the size of our pinky finger nails versus the size of our hips are roughly the size of our fists. So obviously we want to move through those bigger joints as we move through life. Here's another good example of showing different ways to bend. We have an example of maybe brushing your teeth, washing your face, washing our hands. And you can see if we've had a procedure, how that's putting a whole lot of torque on those areas and will increase your pain and prevent tissue from healing versus having a wider base of support and really moving through those hips, using our legs as we do that task. Here's some good pictures here showing some good and bad lifting. Again, showing the neutral spine of making sure we're using all those components of our hips and legs and not our spine versus putting a lot of torque on the back and neck. And remember, our body was made to do this. If you look at kids and athletes, we are supposed to have good hip flexibility and good hip strength. And so a lot of times in our society of conveniences such as chairs, couches, cars, we lose the ability to use our hips, use our legs. Even getting it on and off the floor can be difficult for some people. And so if we're not used to having that flexibility and strength in our legs, that will contribute to poor biomechanics and more stress on the spine. And we're never too old. So a lot of people say, oh, I'm too old to change, or I'm too old to make that better. And you're not. Sometimes we need some guidance, and that's why we're here for you with therapy, to help guide you through ways to get stronger and to help implement some of these changes. Exercise, we mentioned this before. Again, if you weren't active before surgery, it's important that you seek help either with therapy or other means to get into an active lifestyle. And that could be simply getting into a normal walking program, a daily walking program where you get up and just get moving. As we mentioned before, sitting is the new smoking. And so the more we kind of sit, the more pressure will be on our spine. And there really isn't side effects to activity and exercise. It helps blood flow, digestion, keeps your lungs healthy. So get out there and move, and seek help if you need it. After surgery, we want you to walk every day, at least 3 or 4 times a day. Balance that out with some rest, maybe some ice. But that's going to be your biggest healing component after the surgery, is to get up and walk. Sometimes you might get a brace from the surgeon, and they'll set that up with you in the hospital, and the therapist or orthotist will teach you how to use it. And you want to make sure you wear that until you get the clearing from the doctor to discontinue. Exercises after surgery, you may or may not get some in the hospital. But as we've been talking about, sometimes the biggest and best exercise is just changing how you move, how you get out of a chair, how you pick up an object. Things like that will naturally strengthen your legs and protect your back as well, and facilitate your core muscles. So also, outpatient therapy is recommended for all spinal surgery. So make sure you discuss it with your surgeon. Make sure that you communicate with the team to get those visits set up and scheduled after your surgery, so there's not a delay. And remember to take some rest. Sometimes we have the personality that more is better, and sometimes we need a downshift and actually listen to our body. And if we are tired, to take a rest, to take a nap, or sit down for a little bit, because we can overdo things a little bit if we're not careful. So that concludes our presentation from the physical therapy side. I want to thank you for listening, and also remind you to review the supplemental videos that we have for you. And we want to wish you the best and use this as a resource. If you have any questions, please reach out to the Neurosurgical and Spine Clinic and the liaisons that are also great resources. And hope you take care, and we'll see you down the road.